Hello. I'm Dr. John, and this is the channel where health and education meet. Have you been feeling tired all the time, with no energy for the simplest daily tasks? Have you noticed that your skin is paler, your heart beats faster without reason, or that you experience frequent dizziness? These may be silent signs of anemia, a condition that affects millions of people and is often overlooked until it becomes a serious problem. In this video, you'll discover exactly how to identify the main symptoms of anemia before it compromises your health. Here, I will show you clearly and directly the signs your body may be giving and that you might be ignoring. Additionally, you'll understand what causes anemia, how it impacts your life, and, most importantly, the best treatment options to regain your energy and quality of life. If you've been feeling unexplained fatigue, lack of concentration, or noticing changes in your body, this video is for you. By watching until the end, you'll leave here with the knowledge you need to recognize the signs of anemia in yourself or someone you love, preventing more serious issues in the future. Don't let something treatable steal your energy and health. Are you ready to understand better what might be happening with your body? Then, let's get straight to the point. Anemia is a condition that occurs when the body doesn't have enough red blood cells to transport oxygen to the tissues. This means that, gradually, the body loses energy, and even the most basic functions begin to be affected. Often, the person doesn't even realize they have anemia because the symptoms can be subtle at first, such as unexplained fatigue or lack of concentration, which might seem like a result of a busy day. But the truth is that, if left untreated, anemia can worsen and lead to serious health complications, such as heart problems and a weakened immune system. It's important to understand that anemia is not just iron deficiency, as many people think. There are different types, and each one has different causes and impacts on the body. Iron deficiency anemia, for example, is the most common and is related to a lack of iron in the diet or poor absorption of the nutrient. But there is also megaloblastic anemia, caused by a lack of B vitamins, and sickle cell anemia, which is a genetic condition. Knowing how to identify which type is affecting your health is essential for effective treatment and preventing the problem from getting worse. Ignoring the signs of anemia can have serious consequences because the lack of oxygen compromises the entire functioning of the body. Imagine your body as a car. If the fuel doesn't reach the engine in the right amount, it starts to fail, lose power, and eventually, it might stop altogether. And the worst part is that many people live with this condition for years without knowing, attributing the symptoms to stress or the rush of daily life. That's why recognizing the signs early makes all the difference to ensure more energy and a better quality of life. The symptoms of anemia tend to be subtle at first, causing many people to either ignore them or associate them with other daily factors, such as overwork or lack of sleep. Extreme fatigue is undoubtedly one of the most common signs. You might notice that simple tasks, like climbing stairs or carrying a shopping bag, seem harder than before. Additionally, shortness of breath and a constant feeling of weakness could be signs that your body is struggling to get enough oxygen to your organs. And there's more. Sudden dizziness when standing up or unexplained paleness could be important alerts. Another symptom that many people overlook is difficulty concentrating. If you've noticed that you're more forgetful or struggling to focus on simple tasks, it could be a sign that your brain isn't getting enough oxygen. Frequent headaches and even a sensation of cold hands and feet could also be related to anemia. Rapid heartbeats, even at rest, are another worrying sign, as the heart has to work harder to compensate for the lack of oxygen in the blood. These symptoms can vary in intensity, but they all serve as a warning that something isn't right. Visible signs of anemia can't be ignored either. Weak, brittle nails, increased hair loss, and even sores at the corners of the mouth that take a long time to heal are common signs that the body is lacking essential nutrients. And it doesn't stop there. Some people develop strange cravings, like wanting to eat ice or even dirt, a phenomenon associated with iron deficiency. Recognizing these details in your daily life is crucial to seek medical help and prevent the condition from worsening. Anemia can manifest in different ways depending on a person's age and lifestyle. For young adults, for example, constant fatigue and difficulty concentrating might be confused with a busy routine, leading many to ignore the problem. In older adults, symptoms may be more intense, such as generalized weakness and frequent falls, which increases the risk of serious complications. Women of childbearing age are particularly vulnerable due to blood loss during the menstrual cycle, which can lead to chronic silent anemia. Each life stage brings specific challenges, and it's crucial to be aware of the particularities of each one. For those with more active lifestyles, like athletes, anemia can be even more deceptive. Decreased physical performance, lack of stamina, and increased muscle pain could be clear signs that the body isn't receiving enough oxygen. On the other hand, people with sedentary routines may experience anemia more subtly, with symptoms like excessive drowsiness and lack of energy for simple tasks. Additionally, poor nutrition, common in restrictive diets or unhealthy eating habits, could be a determining factor in the development of the condition. Children and teenagers are also not exempt from the risk of anemia, and the signs can easily be confused with normal growth. Lack of appetite, difficulty learning, and even behavioral changes like constant irritability could be linked to iron deficiency or other essential vitamins. In infants, anemia can affect motor and cognitive development, making early diagnosis even more crucial. Regardless of the life stage, being aware of the body's signals and seeking medical advice is the best path to ensure a healthy and balanced life. Anemia can have several causes, with iron deficiency being the most common. This primarily happens due to a diet poor in essential nutrients, which prevents the adequate production of red blood cells. Restrictive diets, vegetarianism without proper nutritional guidance, and even excessive consumption of processed foods can contribute to this condition. Additionally, intestinal absorption problems, as seen in conditions like atrophic gastritis and celiac disease, may prevent the body from properly utilizing the iron ingested, even if the diet is adequate. Another important factor is blood loss, which can be small and continuous, such as in women with heavy menstrual flows or people with undiagnosed gastric ulcers. The prolonged use of medications, such as anti-inflammatory drugs, can also cause minor internal bleeding, leading to gradual iron loss and, consequently, anemia. In the elderly, anemia may be related to silent digestive bleeding, often unnoticed until the condition becomes severe. It is essential to investigate any persistent symptoms because chronic blood loss is one of the primary causes of anemia in adults. Furthermore, some chronic conditions, like kidney failure and autoimmune diseases, can interfere with hemoglobin production, causing a type of anemia known as anemia of chronic disease. In these cases, the problem is not related to iron deficiency, but rather the body's ability to produce and use red blood cells properly. Genetic factors also play an important role, such as in sickle cell anemia and thalassemia, hereditary conditions that affect the shape and function of red blood cells. Identifying the specific cause of anemia is the first step toward effective, personalized treatment. The correct diagnosis of anemia begins with a detailed analysis of symptoms and the patient's medical history. The doctor may order a blood test, which is the most effective way to identify the condition. A complete blood count, CBC, for example, is a simple test that measures the amount of hemoglobin and the number of red blood cells in the blood. This allows for the determination of the type and severity of anemia, as well as the need for additional tests. After all, anemia can be just a symptom of a larger problem, such as a nutritional deficiency or even a chronic illness that in addition to the CBC, doctors may also request tests to check iron levels, vitamin B12, and folic acid, which are essential for red blood cell production. The ferritin test, which measures iron stores in the body, is particularly important when iron deficiency anemia is suspected, as it is the most common form. Anemia diagnosis is not limited to just a blood test. It's important to consider the patient's overall context, such as age, lifestyle, diet, and medical history. However, even after the diagnosis, it is essential to continue medical follow-up. In some cases, deeper tests, such as endoscopy or colonoscopy, may be required to investigate possible sources of internal bleeding that could be responsible for the continuous loss of iron. Identifying and treating anemia as soon as possible is crucial to avoid more severe complications, such as heart problems and lack of oxygen to the brain. Thus, having regular checkups and listening to the body's signals is the best way to ensure good health. Anemia treatment depends on the type and cause identified, and it is crucial to follow medical guidelines. For iron deficiency anemia, which is the most common, iron supplementation is the first line of treatment. This can be done through iron supplements prescribed by the doctor, usually accompanied by guidance on the best way to absorb the nutrient, such as avoiding coffee or tea consumption immediately after intake. Additionally, increasing the intake of iron-rich foods, such as red meat, beans, lentils, and dark leafy vegetables, can help speed up the recovery process. The key is to always follow the prescribed doses and treatment duration to avoid complications. When anemia is caused by deficiencies in vitamin B12 or folic acid, treatment involves supplementing these vitamins, usually through pills or injections, depending on the severity of the deficiency. Medical follow-up is necessary to adjust the doses according to the body's response. For those with a vegetarian or vegan diet, it is essential to monitor these nutrients, as they are primarily found in animal-based foods. Incorporating foods like eggs, milk, and dairy products can be a natural way to avoid this deficiency, but in more severe cases, supplementation is indispensable. In cases of more complex anemias, such as anemia of chronic disease or sickle cell anemia, treatment may involve more specific approaches, such as managing the underlying conditions. In severe situations, such as aplastic anemia, where the bone marrow does not produce enough red blood cells, more aggressive treatments may be necessary, such as blood transfusions or even bone marrow transplants. Each type of anemia requires specific treatment, and the key to effective treatment is correct diagnosis and continuous follow-up to ensure the body receives the necessary care to return to full health. Anemia is surrounded by many myths and misconceptions that can make proper diagnosis and treatment difficult. One of the most common myths is that anemia only affects older people or women of childbearing age. In reality, anyone, regardless of age or gender, can develop anemia, including children and men. Iron deficiency, the main cause of anemia, can arise for various reasons, including poor diet, absorption problems, or even chronic diseases, and it is not restricted to a single group of people. Ignoring this possibility may cause the problem to be overlooked until it becomes more serious. Another myth is that iron supplements always cause severe side effects, such as constipation and abdominal pain. While it is true that some patients may experience these symptoms, the vast majority of cases can be managed with dosage adjustments or by choosing types of iron that are easier to tolerate. Additionally, proper nutrition can be an effective complement to treatment, reducing the need for large doses of supplements. For example, foods like liver, spinach, beets, and even dark chocolate are natural sources of iron, which help prevent deficiency and maintain balance. On the other hand, a myth that should be debunked is the idea that anemia is a simple condition with no consequences. Lack of treatment can lead to serious complications, such as heart problems, difficulty breathing, and even damage to vital organs. Untreated anemia can also significantly affect a person's quality of life, causing extreme fatigue, cognitive difficulties, and lack of energy. Therefore, debunking anemia is essential so that people seek appropriate treatment as soon as they notice the first signs, preventing the problem from worsening. Preventing anemia starts with a balanced diet rich in essential nutrients, such as iron, vitamin B12, and folic acid. Incorporating iron-rich foods like red meat, chicken, fish, lentils, and dark leafy vegetables is a key step to avoiding deficiency. Additionally, foods rich in vitamin C, such as oranges, kiwis, and tomatoes, help with iron absorption, making the diet more effective. For those following vegetarian or vegan diets, it's important to seek alternative sources of these nutrients, like whole grains, legumes, and, in some cases, supplementation. A varied and well-planned diet is the foundation of prevention. Moreover, it is essential for people to undergo regular health checkups, especially those with a family history of anemia, pregnant women, or individuals with chronic diseases. Monitoring iron levels and other vitamins in the blood is an effective way to detect any deficiency early. Self-medication, especially with iron supplements, should be avoided, as excess iron can also harm health. Regular doctor visits and periodic tests help identify any warning signs, allowing treatment before anemia develops. Prevention also involves adopting a healthy lifestyle, including practices like regular physical exercise, stress management, and avoiding excessive alcohol consumption. These habits directly contribute to the production of red blood cells and the proper functioning of the body. Keeping the body active and balanced helps improve nutrient absorption and strengthens the immune system, creating a natural defense against conditions like anemia. Ultimately, anemia prevention is closely linked to a holistic approach to health, which includes not only nutrition but also care for the body and mind. Now that you know how to identify the signs of anemia, how to treat it, and even prevent it, it's time to put this knowledge into practice. If you are experiencing any of the symptoms mentioned throughout the video, don't wait any longer. See a doctor, get the necessary tests, and take care of your health. Anemia can be silent, but with attention and the right actions, you can avoid or treat it effectively. And remember, your body is your greatest tool. Don't put off until tomorrow what can be done today. Share this information with your friends and family so everyone can live with better health and quality of life. And, of course, if you haven't subscribed yet, subscribe to the channel and turn on notifications to keep learning how to take care of your health and well-being. Let's transform knowledge into action together.